We are again in the midst of a surge. This is the second surge after December 2020. We are still at 75% of what we were last year. So at the height of the pandemic, in our region, the Susquehanna region, we were averaging around 110 to 115 patients. Right now we're at 78 patients, of which 18 of them were in the ICU, and almost 80% of them were on the ventilator. Numbers are going up as we march into the colder season. Unfortunately, because of the low vaccination rates, we are bracing ourselves for another tough winter. Overall, across the UPMC system, 75% of individuals who are admitted are unvaccinated individuals. If we talk about the local Susquehanna region, we are averaging around 92 to 95% of people who are unvaccinated are admitted to the hospital. And of them, people who are admitted to the hospital with vaccination status intact, most of them are above age 65, and most of them have comorbidities. A chunk of them do not even know they have COVID. They're just there for some other reason, and they're swabbed, and the COVID test comes back positive. So in short, vaccination does help. The biggest chunk we are seeing is between the age groups of 30 and 50 who are unvaccinated. We are at almost 120 to 125% of our capacity, and especially with that, we have also staffing shortages due to people being quarantined, people being sick, or people just changing professions, because we are fighting this for the last 22 months. And people are just overwhelmed. And then over the last 22 months, people also neglected their own health because they were scared to come to healthcare facilities. Some people were depressed, were getting negative thoughts because of the worldwide surge. So all of that is coming back. So compared to last year, the difference right now is we are seeing COVID as well as non-COVID patients coming in and overwhelming our facilities, which wasn't the case last year. Well, initially when the Omicron variant was announced, was labeled as a variant of interest by WHO, or variant of concern, I should say, there was a big spike, especially in getting the boosters. But we haven't seen a substantial jump in people getting the primary vaccination series. And even though we have seen people coming in for vaccinations, we almost hit a wall right now with regards to people getting primary vaccinations. Yeah, so variants will keep coming on as long as we have the virus in our ecosystem. And that's the unfortunate truth. And whenever the virus comes in, it tries to make baby copies of itself using the human cell machinery, and that's when mistakes happen. And during that, we see some potential variants coming in. Now, early studies which were showing that Omicron had the variant which had characteristics of both beta as well as delta. Beta variant was found in Great Britain, which had more issues with regards to immune evasion. And then Delta variant has features of increased transmissibility. So which means that there was a concern that probably vaccines won't work as good as they should as against the Omicron variant. But now further studies are showing that maybe the transmission might be a little bit higher, but the immune evasion mechanisms are not going to be that bad. And especially for people who've gotten the Pfizer vaccine, there was a statement out that if you take the booster, your antibody titers go up by 25 times. So boosters are, of course, the way to deal with this. So far, we don't think that Omicron might become the predominant variant. It's going to be still the Delta. But again, this is probably not the last variant we are seeing. There could be many more coming through as we go through the upcoming months. It's going to be like the survival of the fittest mechanism. So if a virus needs to propagate and stay in the system for long periods of time, it has to let go of its lethality so that it can conserve and stay in sync with the human system. Not meaning that it won't still kill people, but maybe the killing prowess will go down. And maybe the next 12 to 14 months, we can probably get to that stage, provided our vaccination rates also go up. And then probably we might need boosters like in the colder months, just like the flu virus. So the next couple of years, or at least in the next 14 to 15 months, the prediction is that the severity will go down. It will become endemic, just like the regular common cold or the flu. Yeah, so I think we should be fearful at least for the next upcoming year or so, but again, not lose sleep too much over it. You can do whatever you have in your hands, and that is getting the vaccines, getting the boosters, and doing the right social mitigation strategy. Beyond that, we cannot do much more. But if you do the right things, then we might see a potential end in sight. Don't get me wrong; it's not going to go away completely. The COVID is here to stay, but the lethality will go down, and we can make it endemic from the pandemic stage. And for that, collectively, we all need to work on it. But I wouldn't really lose my sleep over it, about the different variants coming in. This is a well-known fact of viruses. And the only thing we can do is to protect ourselves, what we can do from our end. If we can get more than 75 to 80% of population vaccinated, then we'll go a long way in controlling this particular pandemic and then make it turn into endemic. We need to flatten the curve. That's the most important thing. Second of all is, even though you are vaccinated, and if you are in the midst of a crowd where the people are not your immediate family members, and if you're in an indoor environment, you definitely need to wear a mask. And of course, social distancing, hand washing are important as well. But masking has proven to be the most important among the three. Now, if we want to make this an endemic virus and we want to control the lethality, it's going to be a collective effort. We need to do the right thing. And the most important strategy which one can do is, of course, vaccinations. Epidemics and pandemics like smallpox, polio were controlled only through vaccination. And that's the only solution, unfortunately. The thing is, we might need to get some boosters for a while. I don't think it's going to continue forever, but maybe less like the flu. During the colder months, we all will need to get us extra jab in our arms. But I think that's the way out. We are seeing a huge influx of COVID as well as non-COVID patients being admitted into our facilities. And that puts an enormous strain on us, on the healthcare staff, and then eventually that strain can get into the community. So I think it's a collective responsibility to keep this under control, enjoy the holidays responsibly, and hope for a healthy season of festivities.